more muscle. Today I'm going to be talking to you guys about some health things. We're going to be doing some tests and we're going to be asking some questions. I'm going to help you guys with the answers. So if you're in nursing school, this might help you. Or if you just want to improve your health knowledge, this will help you. This class is super hard, so let's get to it. So the first question is, a nurse is assessing a newborn who has congenital diaphragmatic hernia. Which of the following findings should the nurse expect? So guys, the first answer could be barrel-shaped chest. Or that's question D. Barrel-shaped chest, generalized petechiae, increased blood pressure, and distended abdomen. So guys, distended abdomen is where your stomach's a little swollen. Increased blood pressure is also a problem. You guys know what that is. Generalized petechiae, that's like kind of like rashes everywhere. And then barrel-shaped chest, that's usually from a breathing disorder. So guys, let's go to congenital diaphragmatic hernia. What is that? So guys, this is a rare condition, and this happens in a baby before birth, and it occurs early in pregnancy when a baby's diaphragm, the muscle that separates the chest from the abdomen, fails to close as it should. This leaves a hole in the diaphragm. This is called a hernia. So some symptoms include severe trouble breathing due to small lungs that don't work well, a type of high blood pressure that affects the arteries, the lungs, and the right side of the heart, and problems with development of the heart. So guys, based on the questions, we got barrel-shaped chest. Guys, that's usually from a breathing disorder. So we're going to check that, and that is the correct answer. So barrel-shaped chest. And the nurse should expect newborn who has congenital diaphragmatic hernia to exhibit a barrel-shaped chest, as abdominal organs have shifted into the chest cavity. So guys, that's the right answer. We go to number 2. A postpartum nurse is caring for a client who reports excessive sweating during the first night after delivery. Which of the following statements should the nurse make? A, this is an attempt by your body to retain the fluid gained during pregnancy. B, this is caused by an increase in your estrogen hormonal levels. C, this is caused by an increased pressure on your veins in your lower legs. And D, this is a source of your fluid loss after delivery, guys. So the correct answer is D. When you have birth, you're going to give you're going to lose a lot of fluids, so your body's going to heat up. So postpartum diuresis, that's postpartum sweating, is the loss of remaining pregnancy-induced increase in blood volume. The loss of excess tissue fluids begin within 12 hours after birth. Fluid loss by urination and perspiration results in a weight loss of approximately 2.27 kgs, 5 pounds, during the early postpartum. So guys, that's the right answer is D. This is a source of fluid loss after delivery. So remember, after delivery, excessive sweating, that's going to be a source of your fluid loss after delivery. Okay, now we got question 3. I actually got this one wrong, so we'll go over why I got it wrong. So a nurse is discussing the risk factors for necrotizing enterocolitis, NEC, in newborns with a newly licensed nurse. Which of the following factors should the nurse include? Postpartum birth, macrosomnia, respiratory distress syndrome, maternal gestational diabetes. So post-term birth is just after birth. Respiratory distress syndrome, that's where you can't breathe well. And maternal gestational diabetes, that's when you get diabetes during pregnancy. I don't think it has anything to do with that, so you want to eliminate the ones that aren't right. So what is necrotizing enterocolitis? So what is that, guys? Let's see what it is. So this, guys, is for premature babies. This causes the intestinal tissue to die. So this can be very harmful. So when those intestines die, let's see what the symptoms say. So this is actually going to affect the immune system because babies' immune systems haven't fully developed, and that's why that's going to happen, and you're not going to be able to absorb those nutrients, and it's not going to work as well. So the correct answer is the respiratory distress syndrome. Respiratory distress syndrome is a risk of NEC. Respiratory distress causes intestinal ischemia, secondary to hypoxia. Ischemia is like skin breakdown or breakdown. Macrosomnia, that's the question B. Macrosomnia, guys, this is a condition in which newborn weighs more than 8 pounds and 13 ounces, so it's a big baby. And it refers to a very large body size, particularly an oversized fetus. You can see this a lot in overweight women. A lot of their babies become very, very big. But anyways, let's go to the next question, guys. A nurse is caring for a client who is in labor and received mepernidine for pain 1 hour before entering the second stage of labor. Which of the following actions should the nurse take? Assess the client's reflexes, assess the newborn for respiratory depression, assess the client for bradycardia, assess the newborn for signs of opiate withdrawal. And the correct answer is B, guys. Assess the newborn for respiratory depression. So let's talk about this. Mepernidine is an opioid. So what do opioids do? They're going to cause constipation. They're going to cause your respiratory rate to go down. And guys, so normal respiratory rate for adults is 12 to 20. So you want to breathe in and out 12 to 20 times at rest per minute. And then for a baby, it's supposed to be 30 to 60. So it's a little faster. So what we want to do is obviously assess the newborn for respiratory depression, because that mepernidine, that opioid, is going to slow down that respiratory rate, and that can cause not enough oxygen getting to the fetus or to the mom. So yeah, we want to assess the newborn for respiratory depression. Next question, guys. A nurse is teaching a group of clients who are pregnant about vitamin K for newborns. Vitamin K helps prevent which of the following conditions in a newborn? Altered carbohydrate metabolism, hyperbilirubinemia, intracranial hemorrhage, or hypoglycemia. So guys, altered carbohydrate metabolism, that's false. Hyperbilirubinemia, that's like a excess toxins in the body, and that's not. No, that vitamin K doesn't do anything. Vitamin K prevents bleeding. So intracranial hemorrhage is correct, because you're going to be bleeding. That baby has a risk for bleeding if it doesn't get that vitamin K. Vitamin K stops bleeding. So there's been many times where a brand new baby hasn't gotten vitamin K, and they accidentally get a cut on their belly, or the umbilical cord is still leaking or whatever, and they can bleed out. So you want to make sure they can get that vitamin K, and that will decrease the risk for intracranial hemorrhage. Vitamin K is necessary for blood clotting. Is produced by the action of bacteria in the gastrointestinal system. A newborn's gastrointestinal system is sterile and therefore deficient in vitamin K at birth. It needs to be supplemented to protect the newborn from bleeding until gastrointestinal system is colonized with flora. So in the beginning of the newborn's life, the vitamin K is not working properly, and the stomach doesn't have can't digest and can't get that vitamin K going. So that's why we supplement it with it, and that can decrease the risk for intracranial hemorrhage. Anyways, guys, hope you enjoyed this. Hope you learned something. Thanks for watching. Comment and tell me what you guys think I should teach about or what I should go over. And thank you for watching.